With us right now, Dr. Joe Congini from Akron Children's Hospital. Good morning, Dr. Joe.
How's it going, Gene? How are you today?
I'm doing really well. It's a pretty day outside. Now, I understand you want to talk to us this morning about some sort of malady or injury that affects children that could affect them more later on as they grow up. What is it?
Yes, yeah, it sure can, Gene, and thanks so much for giving us the opportunity. It's one of those, another reason why we're so blessed to have, so many children's experts at a children's hospital in town, because this is frequently misdiagnosed, can be frequently mistreated, and it can have effects down the road. It is another one with a real funny name. It's called osteochondritis dissecans, OCD. There's a mental health condition known as OCD, too, so that gets mixed up. But OCD, I went around yesterday, and the trainers and therapists were saying, please talk about OCD. Haven't talked about it in a while, and we're seeing so much of it right now this fall. So I wanted to touch on it today, Gene, a little bit. It's a condition where when kids are active, they start to get kind of a funny-looking dent in the bone, and later on it progresses pretty quickly to more of like a chuck hole. It looks like a chuck hole in the bone. The bone and the cartilage separate from the bone and leave this kind of chuck hole spot in the bone, and it really needs to be looked at and treated appropriately, and it can have some long-term implications to it. So it is seen most commonly in the knee. It is also, though, seen in the ankle and gymnasts, or the elbow of pitchers and throwers. But number one place that we see it a lot is in the knee, and it swells, and after a period of time it locks up. It's very painful on the joint line, so you could understand how people who see mainly adults say, that's a meniscus tear. I've had those before and things. And it's a totally different treatment, Gene, than a meniscus tear. And one thing that's kind of interesting about it, it's been around a long time, it's one of the few things left that it can be totally diagnosed with just a plain X-ray. You don't need an MRI to diagnose it. Sometimes my surgical friends get an MRI to see if it's stable or not and make a decision on whether to operate on it or not. It's also unique because so many things in kids heal on their own and don't need surgery. 80 to 85% of what we see in sports medicine doesn't need surgery in kids under age 18. And this is a thing that does not infrequently need surgery. And so we have some decisions that we have to make about whether it's surgical or not. And yesterday I talked to one of my most experienced surgeons, Dr. Kerwin Jones, who's a longtime team doctor from Copley, just talking about some of the newer techniques in treating OCD. And what we look at is, how far is this athlete along in maturation? How far are they in growth? If they're early in growth and it's a small dent, we usually give them a chance with physical therapy to get better. But if it's a big lesion, a big chuck hole, it has a big loose piece to it, it's unstable, it's just not going to heal, and it's going to end up with rough edges that could go on to arthritis. And so we do go on to fix these. And I just wanted to touch on just one more thing, is the treatments of fixing these. So we said that some, if we catch them early, can be non-surgical and non-operative. In the older days, we used a screw to fix the ones that had a big chuck hole piece to it. And now there's a newer kind of metallic arrow, they call it. It's pretty cool. I looked at a few online last night and in a couple articles. Dr. Jones was telling me how cool it is to use that new metallic arrow. They put it exactly in the right spot to hold that bone in place and fix that chuck hole. But even a cooler, relatively newer treatment is they will sometimes grow cartilage cells in the lab, and then they'll use these cartilage cells to fill that hole, almost like filling chuck holes in Copley, Ohio, and they'll fill these in, and they'll try to smooth it off as much as it can so it's not going to lead to arthritis later. And let me finish with the good news here, Gene, is that it recovers in about 4 to 6 months. So that is a long time, but it gets a pretty good recovery, and the success rate when we catch it and we do the drill fixation surgery is about 85 to 90% successful. And nowadays, with using the cartilage cells that are grown in the lab, it's about 80% successful as they smooth off that joint so that these kids get back to activities and they don't go on to a terribly beat-up arthritis knee that needs a knee replacement later on. So it's real important to see a pediatric expert who's seen a lot of OCD. If your kid or your grandkid unfortunately has this problem known as osteochondritis dissecans.
That's fantastic news, 80 to 90% success rate with that surgery. So thank you so much, Dr. Joe Congini with Akron Children's Hospital. He's with us every week at this time, so we appreciate him being with us.